Yes, we are live on Facebook also. Um, a very good morning to all those of you who joined us on the Zoom call. This is a very, very impromptu call. It wasn't really planned the way it's happening. It wasn't supposed to be a live, but then since Dr. Tausif was very kind enough to share his time with us, I thought we should take this information to more people who could benefit from this session. So currently it is also getting screened live on my Facebook page. I will try during the session to copy the links and also tag it on the other members' pages so that your friends in turn can actually view the session. A short introduction for those of you from the event fraternity, especially from Chennai, needs no much introduction to Tausif, who is primarily a doctor. I always remember him saying his favorite role is being a teacher. He teaches a lot of kids who are studying to be doctors, and was an RJ based out of Chennai at MC. Currently in Hyderabad, an emergency specialist and the medical director for a hospital called Premier Hospital. And the reason that I've chosen Dr. Tausif to join us is because he being an emergency specialist, I think he's one of the front-end people who actually handle people who pretty much panic when they're in trauma. So I think he is the one who has the experience to tell us what we should be going out and doing to our near and dear ones when we get to know that they are COVID positive or anybody in our family itself. So without further delay, once again, thank you, Tausif, for joining us. And I'm going to request you to please take over.
All right. Thank you, Maryann. First off, are you able to see me? Or you just see my screen?
Yes, Doctor.
Yeah, we are able. Okay, that's great. Yes, I'm not able to see myself, so I'm all right with that. Okay, hi everyone. Thank you, Maryann, for getting me here. Hi, Sumi, and all of you who've joined here. Miss you guys. First of all, it's lovely when I'm in Chennai, but it's not so great when I'm not there because I miss all my friends. But let's just get into the topic right now. COVID-19. Yes, it started in 2019, November, December, but it's gone on to transform our lives over the next 2 years. I wouldn't like to use the word disturb, although that would probably be the most appropriate word. What I hope we are here to do today is to become aware about this disease so that we can protect ourselves and our loved ones better, and also go on and spread awareness about the right things to do and not to do, the wrong things which we must not do as we go on and educate other people around us and give them the right kind of information. I have shared a screen, if all of you are seeing that screen, because I want to start off with giving you an idea of how this disease progresses once somebody is infected with it. And then we'll talk about the do's and don'ts in just a bit. Now, the coronavirus is a virus that has been in existence for as long as I have known medicine, or people have known medicine. It is a virus which affects us with the common cold and flu-like symptoms every 2 to 3 months. Now, why does it do every 2 to 3 months? Ideally, when we get exposed to some infection, we're supposed to develop antibodies to that infection. And then we're supposed to not get that infection or the same severity of the infection in the next round. The coronavirus and the flu virus, of course, they are interesting viruses. They mutate. Every 2 to 3 months, we have something called as an antigenic shift. And when this antigenic shift happens, think of it as, the disguises that they show in the movies. So it's like, I'm acting as a superhero one day, I'm acting as a villain another day, it's like that. It's all right. Am I audible? Are we good?
Yeah, Tausif, you're good.
All right. Okay. Yeah. And so this is what happens. So it kind of changes its shape and structure so that your body's immune system, which responds to all infections, cannot react to it. So in that case, what happens? You get it every 2 to 3 months. Now, one fine evening in 2019, this coronavirus decided to change its shape so much that instead of just affecting your throat and giving you flu-like symptoms and cold and cough symptoms, it decided to progress further and go down into the lungs. And that made it very scary because till then, we didn't consider it as such a big disease and we didn't make any antivirals against it because it was a self-limiting disease. We don't treat the flu with antivirals, yes? So, and then it suddenly became really, really dangerous because then it started making people, they had difficulty in breathing and they were not able to make it because of the extensive lung damage. And we thought that's what we were treating. And then it so happened that because it was triggering off the body's immune system so strongly, it's like if I get into a neighborhood fight, yes, I will go and say, if I can beat that guy myself, I will do, all right, let's just hit that guy and come off and I'm happy. If no, that guy's stronger than me, I will then call a few of my friends and say, let's go fight with that guy. And then we go and fight and he'll bring his friends. And then you see it keeps escalating and growing bigger. The body also responds similarly to the coronavirus. When it then finds it in the bloodstream, it realizes I cannot kill this guy. I need help. So it mobilizes help from all over the body, what we call as inflammation. Yes, where all your neutrophils, everyone tries to come and fight. Now, although it seems like a good thing, you're asking for support, it puts tremendous strain on our body. Yes, our body then goes under a lot of strain. It's not able to handle the sudden demand that's been put on it. It's like saying, you know what, I have savings in my house, but I'm just going to use it for this one big party that I'm going to throw. And then tomorrow I don't have anything else left for, anything that I want to do in my house, even for basic essentials like food. So something like this is the response to the coronavirus that is triggered off because the body tries to kill it and is not able to do so. The interesting thing is the virus only lasts, is infective or is awake and doing things in your body for about 10 to 12, maximum 14 days. And then it dies, it's natural death, because all viral diseases are self-limiting. But this inflammatory response triggers a lot of problems. It can cause blood clots in your blood vessels, leading to problems like heart attack, leading to a stroke that can happen, leading to a clot in the lungs, which makes increased breathing and difficulty in breathing. Okay, so that can also happen. So there is increased clot formation. It also triggers off symptoms in your stomach like diarrhea, which is not life-threatening, but it is troublesome. There is abdominal pain, there is diarrhea that can also happen. And then we kind of slowly help them tide over it by saying, okay, telling the immune system, slow down, it's all right. The virus is gone. You just don't destroy the body anymore. We don't need so much of a stressful response. Don't spend all your savings on this one particular problem and calm down. And that is how current medical treatment is working. So this is the coronavirus. Now, once we understood this, and it took us about the greater part of last year to understand this, it was only by about May, June that we were figuring out, oh, this is how it works. So we were able to then treat people and get them better. And the virus also continued to mutate as it changed its shape. And it then went on to become less virulent. Virulent means less dangerous to us, all right? And we were happy. We're like, okay, the number of cases are coming down. We kind of seem to have, passed the curve and we are okay. India never had a second wave. India had the first and the second wave all mixed up together because we opened lockdown early. But then again, this year in the beginning, we started seeing a disturbing trend. People were coming back to us with coronavirus-like symptoms and the RT-PCR was turning negative. Now that was dangerous because here the mutation has made it more infective again. And also it has disguised it enough that we're not able to recognize it. We're not able to find it. We were having a tough time explaining to the few handful of people who were infected that, listen, you have coronavirus. And they're saying, sir, doctor, my RT-PCR is negative. Are you playing a game? Do you want to admit and make money out of me? Is that what you're trying to do? And it was tough. And then disaster struck. We went back into a pandemic wave because people were not sufficiently forewarned enough, because even the doctors are confused because the RT-PCRs are negative. So we couldn't really forcefully tell people, the virus is coming back, please take care. And now it's come back in full strength, and it is more dangerous than before because it spreads faster. We are seeing an increasing trend of people, families getting affected, entire families coming to us because it's very contagious. It quickly passes on from one person to another in a closed space, faster than the earlier virus. And also because before people were scared and they would come to us early. Now people were sitting at home waiting to see where this fever goes and then coming to the hospital only when they were really, really ill. And we are not able to do anything for them when they come after their oxygen level drops to 40, 50, 60. It becomes a losing battle for the doctors to fight. So these are the current issues that we are facing, along with, of course, the scarcity of resources. So this in a nutshell is what the coronavirus story has been over the last 1.5 years. Now, why did I put this photo up? Is for you to understand how this disease progresses. So as a receiver on the other end, God forbid, on the other end, you must understand how the disease phase progresses and how people recover and go, so that you know what to expect and what to explain to your family and what to prepare yourself mentally for if you're trying to help someone with the disease. So first and foremost, the person gets exposed to the virus, right? And then there is a phase called incubation. That is the point number 1 that you see on the photo there, the incubation phase. Now, what is this incubation phase? It's like from the point of entry of the virus into your body to it becoming a disease, meaning to it becoming a problem for you to recognize, like there's loss of taste and sense, taste and smell. And then there is coughing that you can have a sore throat that is possible. You can also have tummy upset, you can have diarrhea, nausea, you can have extreme fatigue, weakness that you can feel. These are all mild symptoms, yes? Either you can have no symptoms, which we call asymptomatic people, or you can have mild symptoms, okay? And these are the mild symptoms that I'm talking about: loss of sense of taste and smell, cough, a sore throat, diarrhea, abdominal pain, nausea, vomiting, weakness, fatigue, headache, yes? So these are all things that you will find in the mild symptom phase. And of course, nowadays people are coming with, they're just fainting spells that they have, and chest pain that they are having, acidity that they are having. So they're also coming with that. So no matter what the symptom, the first diagnosis that we want to rule out or rule in is a coronavirus. So don't be upset when the doctor is saying, why don't you do an RT-PCR? Remember, this is still a disease that we are trying to understand better and better, and it is a mutating virus. It changes shape. It can present in different ways. So we're trying to make sure we are not barking up the wrong tree, or rather, in a situation of a pandemic, we're trying to say, okay, let's first rule this thing out, and then figure out what else is there that we need to treat. So that's what they're trying to do, which is in the best interest of the patient. And there's no harm in getting an RT-PCR test done, because now it's not like anybody's coming and harassing you over it. So reasonably better than what it was last year. At least there's a little more sense in the administrative side as to how to handle it, right? So if I take about 100 people and they are infected with the virus, after the incubation period, 40 of them will be asymptomatic, right? No symptoms at all, but they're still carriers of infection, mind you. They can still infect other people. About 40 of them will be mildly symptomatic. So these 80 people, or 80%, don't need to be in the hospital. They can stay at home and get treated, provided some good doctor is advising the right way, and they're following everything sincerely, not giving excuses like, oh, the mask is suffocating me, how can I stay alone, oh, it's isolation, I'm not used to all of this, I'm getting, all of that is just excuses that we make. And I'm not going to get into that, but I'm just saying, if you sincerely follow the advice that the doctor is giving, these should get better on their own and become all right. But there is a population that is at risk. 1, somebody who's got diabetes for many years. 2, somebody who's got hypertension for many years. 3, somebody who's overweight, obese, yes, them. And then 4, somebody who's exposed highly to somebody with the coronavirus, as in somebody who's a caretaker of a patient with the coronavirus disease, but they are not taking sufficient protection for themselves, not wearing a PPE, not wearing a mask. We tend to get very emotional when it's our relative. We want to just throw caution to the wind and go take care of them. So that is why we must be careful and protect ourselves, because if we are protected, we can treat and help more people. If we ourselves are affected, then other people will have to treat us. So if these people are not following this, then they tend to go on into the moderate to severe phase, which is the remaining 15%. These people start having breathing difficulty. Yes, so the first thing is that's the point number 2 there that you're seeing, the pulmonary phase, as we call it. The lungs get infected. Even in the mild phase, the lungs may get infected, but they may not drop in oxygen levels. Yes, nothing to worry about it. Okay, if they see patches on the lung, but the oxygen level is fine, then you're still okay. It's when the oxygen levels start dropping less than 95 that you start thinking that, yes, I need oxygen. And oxygen is a good thing, right? Oxygen is a good thing because it allows you to kind of tell your own body to not take stress. Yes. Your body realizes, I don't need oxygen. And if you don't give it that, your body realizes that it needs oxygen, sorry. And if you don't give it that oxygen, it starts trying to respond by the other inflammatory process that I was talking about. It starts recruiting help from the rest of the body. So you're going to go into the stressful phase faster if you don't give oxygen at the right time. So don't delay giving the oxygen to somebody saying, oh, night I'm having 92, 93, but in the morning I'm 95. No, that is not a good idea. Now, ideally, at this phase, when the oxygen level starts dropping, you should be in a hospital, because the hospital can monitor you and try to give you oxygen as required. But because of the fact that a lot of mild symptom people are going to get admitted in hospital, you're not having enough hospital beds. So you are now forced to use oxygen at home. Either which way, oxygen is important in this phase 2, where you're in the pulmonary phase and you need to get the oxygen out there. Now, when this is going on, if the patient recovers from there, we call it the moderate phase. They've not gone into the severe phase, and this is another 10%. So out of the 80 you finished, and you have another 10%, 10 to 15%. So you can get about 95% are okay. They get to this moderate disease phase, and then they start recovering after about 10 to 14 days, and then they go home. But they should be in the hospital when the pulmonary phase happens or the oxygen drops, and then they should be there because you can quickly monitor, give them the right intervention, and so on. About the remaining 5% then go on into the inflammatory phase. The rest of the body starts, this is point number 3, the pro-inflammatory phase. The rest of the body starts responding, your blood pressure starts dropping, you're severely distressed, you're not able to breathe. You need to put on machines like the NIV, the non-invasive ventilator, which is a mask on your face and forceful air being blown. And sometimes they need to go onto a ventilator. And all this, if it's done early, it's beneficial. If you delay to a point where you reach the hospital, the next thing they're going to do is put you on a ventilator, then life is at imminent risk. Okay, so don't delay care till that level, that you get to severe phase and then get to hospital. That becomes really, really difficult for the doctor to treat. Very few of them go on into the number 4 point, the fourth phase called the pro-thrombotic phase, where they have blood clots, they can have heart attacks, strokes, or clots in the lungs. This can also happen. Then they need specialized medicines which burst these clots and then help these people recover. And that is also, again, up to the potential of the doctor and the staff to recognize it and get it. But this fourth phase is the reason why people have sudden deaths. People just collapse and pass away, and then they die, is because of the fourth phase. Because here there are sudden clots happening in the heart, they have heart attacks, and they don't make it to the hospital. They have lung clots, and then they just can't breathe. All of a sudden, their oxygen this morning was 90, and then by in another 2 hours it became 40. So these are the people who are then suddenly going to deteriorate, and no matter what you do, it becomes really, really difficult to save them. And then, of course, if you thankfully pass through this safely, then you recover. God forbid the other thing happens, and the other outcome happens, then it's death. So that's how it works out. So this is what I wanted to show you on this thing. So I'm going to take out the sharing, and then I'm going to continue telling you the things that we do right and wrong. Or if you want to ask me questions about it, you can ask me, Maryann. But this is how the disease progresses, and this is what you can expect in a hospital. Now, in terms of treatment, what do we do as doctors? In the asymptomatic phase, we just give you immunity boosters. We give you, vitamin C, vitamin D. We ask you to do betadine gargling. We may give you zinc tablets. Just about these 3-4 things. That's all that we do in the asymptomatic phase. In the mild symptomatic phase, we give you, along with these, we may give you some symptomatic treatment. Like I can give you an antihistamine if there's a cold, or a cough syrup if there's a cough. I can ask you to do steam inhalation, drink warm water. I can probably put you on an antibiotic. Now, the antibiotic is at my discretion. Somebody will put azithromycin, some people put doxycycline, a few people like to add ivermectin. No harm done. Yes, I also may put you on an antacid like Gelusil or pantoprazole, or nowadays we use famotidine. So I may put you on these medicines. All these medicines are good for you, and it helps you tide over your mild symptom phase. In the second phase, when the lungs get involved and the oxygen level starts dropping, we start you on steroids. Steroids are very, very important. But remember, steroids are started only for people whose oxygen level starts dropping. What I tend to see increasingly nowadays is that a lot of doctors, especially general practitioners, put people on steroids during the mild symptomatic phase, which is not indicated. Steroids are not without their side effects, and the evidence is not in favor of giving it during the mild symptomatic phase, so it's not indicated. We see people putting on blood thinners in the mild symptomatic phase. It's not required. Again, we don't put blood thinners for people who are mildly symptomatic and staying at home. Don't put them on blood thinners. Especially older people, you're increasing there, and the people who are having kidney disease, especially, you're increasing the risk of bleeding further. Or if they're already on, antiplatelets like ecosprin, clopidogrel, no problem. They can just continue that. They don't have to stop it. It's good for them, but don't need to additionally put on an anticoagulant and then treat them like that. So that's not necessary. Only when they get into the phase where the oxygen level starts dropping, we will then admit them and put them on blood thinners, or rather anticoagulants. We don't technically put blood thinners, anti-clotting drugs that we can use. So we use that. If they worsen, then we can put them on machines like, the oxygen level increases, we can put them on a non-invasive ventilator. We can also then put them on, if necessary, a mechanical ventilation or invasive ventilator that we can do. These are the other things that we do. and God forbid they go into the thrombotic phase, then we use something called as a thrombolysis or clot busters. So we can use clot busters to remove clots and see if they improve with that. So this in a nutshell is how we assess the patient and treat them depending on which phase they are. How do we know which phase they are? We do blood tests. We do blood tests. We do an initial CT scan to find out what is the extent of the lung damage. We do CRP, D-dimer, LDH, and we also do ferritin levels. At least LDH and ferritin, I only do it in the beginning. But I monitor the CRP and the D-dimer every 48 hours at least, or sometimes every day if it's really high, to see what is the difference that I can make. Should I increase my dose of steroids or should I increase my dose of anticoagulants? I look at that, and then we figure it out from there. So in terms of treatment, we do that. Now, talking about remdesivir, tocilizumab, and plasma, first and foremost, plasma doesn't help. There is no point in donating plasma to anybody. It doesn't help. Okay, there's no treatment. Remdesivir helps if it is given early in the disease. If it is given within first 10 days of symptom onset, remdesivir helps decrease the viral load because it blocks viral replication or increase in the virus load. So it helps, but it's given late, it's not helpful. It's not a curative drug, so there's no need to buy it on the black market. There's absolutely no need to go and say, oh, I'm not getting it here, I'll pay 20,000 and get it from there. Absolutely no need. Tocilizumab is a very, very specific drug given in a very, very specific indication. When the patient is rapidly becoming bad, then we think, okay, we can give it tocilizumab. We don't give it for somebody who's slowly becoming bad over a period of 10 days. We don't give tocilizumab. No. Just because they're on a ventilator, we don't give tocilizumab. No. Absolutely no. We give it when today somebody's fine, but tomorrow suddenly their oxygen requirement is gone really high and they don't have any other concurrent infections, then I can give tocilizumab. It's a very, very specific indication and not needed for everybody. So again, this whole thing of going and buying it in black for, oh, it's a 60,000 or 70,000 drug, but you're buying it for 1.5 lakhs, 2 lakhs. It doesn't make sense, right? It is this kind of uninformed demand that creates a black market for people, and they hoard it and then they take advantage of it. So we tell them not to do that, such things. So we never encourage people to buy it in black. It doesn't make any sense. So in a nutshell, that's the disease. Those are the different phases of the disease. This is how we assess the disease, and these are the medications that we use for treatment. So if you wanted to know about COVID-19 and the current trend in treatment and what we do, this is about it. I think I'm going to stop talking at this point. I myself must have spoken for about 20 minutes. Any questions, I'm happy to take.
All right, for those of you who have questions on the group, you can put it on the chat. And for those of you, if you're watching us on Facebook, you can send in your questions on Facebook. Tausif, a few questions. The first question that I would want to ask is, when is the right time to test from the time you probably know that you're exposed to COVID?
Okay, so the right time to test is about 5 days into the disease. Yeah, the 5th to 15th day is when you want the disease. Hi, Rehan. All right, so is when you want to test for the disease. Okay, so you know, if you're doing it on the 5th day, you find that it's negative. You know, we generally would repeat the test again because we are seeing more and more negative people presenting with corona-like symptoms. We immediately do the test the next day. And if it is already 5 days and beyond, or 7 days at least, we get the antibodies also to check. Okay, maybe the RT-PCR is negative, but the antibodies might tell us it's still corona. But as a lay person, if you are somebody who's sitting at home and you're mild or no asymptomatic, absolutely do it on the 5th day. It's the highest chance of you knowing if it's there or not. And if it's still negative and you're okay, repeat after another 10 days. That's all you need to test. Do we need to test to tell if the patient is cured or the person is cured? No. Unless it's a requirement for you to travel or in your workplace, they're asking you for you to do it. There is no need to test again and see if you have become negative. I'll tell you why. I told you the virus it can create problems for about 10 to 14 days, right? After that, it's not going to create a problem, but it can stay in the bloodstream for anywhere between 15 to 40 days. The pieces of the virus, the fragments of the virus can stay for about 15 to 40 days at the maximum. So if you're going to test the 28th day and you're absolutely asymptomatic, you don't have any problems at all, and you find that there is RT-PCR positive, there's no need to panic. There's no need to think, oh my God, what is this? I'm still positive. There's nothing to think like that, right? So we generally, in treatment terms, don't repeat a test to check if the patient is recovered. We see most on other tests and patient symptoms. But if you're traveling and if you are needed for your office, yeah, you can check it about 10 days after you've recovered. So you should know. Your voice is gone.
Sorry. Yeah, that's So if you're at home and other parameters are normal, so this call will be discussing about if other parameters are normal and you're at home, what are the precautions to be taken? So what is the oxygen level you want to maintain in the oximeters that we get in the market today? And so that we know when we have to reach out for help or go to the hospital.
Okay, see, the normal oxygen level in our human body is about 95 to 100. Like I'm breathing normal air, my saturation should be anywhere between 95 to 100. Yes. People who already have pre-existing problems which cause them to drop in saturation for instance, lung diseases or heart diseases, they should have a reasonable idea of what their baseline saturation is. And then they know that's their normal, yeah, which will be anywhere from 88 to 92%, right? In case they already have lung disease because of whatever reason, okay? But for a normal, healthy individual, it's about 95 to 100. So if you have an idea of your baseline oxygen saturation, if it's 95 and above, anything below 95 is something that you should think, okay, I'm kind of getting affected. Maybe I need to be in a setting where there is oxygen available. That's important. For people whose already pre-existing saturation is lesser than that, then they have to have an idea of if it's dropping below their normal, so then they can decide if they need additional care or not. That's important. Yeah. So if I take out the affected people, it's 95, the number that you need to remember.
Okay. I'm going to ask you
Maryann, sorry. If in case you don't get a bed in a hospital and you're putting oxygen at home and you're treating your patient, the number is 90, okay? So make sure that it stays above 90 at all times when you remove the oxygen. If you remove the oxygen and it's dropping below 90, they definitely need to be in a hospital, okay? With the oxygen, it's all right, you can maintain at 95, but without the oxygen, if it's dropping below 90, they need to be in a hospital.
What are the other symptoms, leaving aside people with other ailments, but some unhealthy individual, what are the other symptoms that we need to request the patient to go to the hospital?
Other symptoms?
Other than the O2s?
I forgot to tell him fever, right? I didn't mention fever. Yeah, fever is one of the important symptoms of coronavirus. It starts with the fever, but the fever settles down in about 3-4 days or 2 to 3 days, depends on the individual, right? Unless there's another infection along with it. So if the fever is really high and you're not able to take care of yourself, you feel really, really tired and like somebody just put you through the washing machine or something, the dishwasher. So you just need to get to the hospital and make sure you're on some IV fluids. Like otherwise you're going to get dehydrated very fast and feel really, really unwell. So yes, if you have really high grade fever that's not letting you do anything, you feel severely dehydrated, your tongue's going dry all the time, then you need to be in a hospital. You have cough that won't let up at all. It's like really, really severe cough and you're just coughing all the time. And your oxygen level is going down when you cough, but it comes up normal when you're not coughing. Again, that means your lung is getting badly affected and you must be in the hospital. Of course, oxygen is one other thing which you think that you must be in the hospital. And if you're having severe chest pain and fainting spells, yeah, that means something's affecting your heart as well. So be in the hospital for that reason. Yeah. So high fever, severe dehydration, oxygen levels dropping, persistent cough, which is not letting up. And when you're coughing, your oxygen level is dropping. These are the reasons you must be in the hospital, other than other alarming signs.
Tao, can you give us the grade of fever that is okay for us to handle at home? Because day before yesterday, I had got a call from a friend's cousin who was having fever 102 for the last 4 days, and they never knew, no other symptoms. They never knew whether that was normal or not normal.
So there is no grade of fever as such. It's all about how much can you take. Yeah. If fever is subjective, some of us are more resilient. We don't mind fevers. We just say, fever, okay, fine, I'll take a tablet and I'll be all right, no matter what the grade of fever is, right? Even if it's 102 or 104, it doesn't really matter. But if the fever is debilitating, meaning the fever is not letting the person get up from the bed, they're feeling really, really dry in the throat, and they're just not able to do anything and move about, then they may need some IV fluids, and that means they will need some medical help. If somebody's coming home and giving you IV fluids, great. If not, we go to a hospital, get some IV fluids at that point in time. Otherwise, if you're just walking about doing things, temperature is 102, no problem, pop a Dolo or a pop a paracetamol, I'm okay now. Don't worry about it. It's not the number that is important. It is how you feel that is very, very important. I mean, I never check my temperature, to be very honest. I have, in all the times that I've gotten fever, I never check my temperature. I just don't. I just think about how I feel and I treat myself. That's all. Yeah, being a doctor helps, but I never check my temperature. Yeah.
Okay. The first thing that we feel that we need to educate people about is not everybody on who has COVID needs hospitalization. If you can guide us and tell us what is that percentage, do you have a rough bracket of people who would any rough
numbers you mean? Numbers of who needs to be in the hospital. Only about 15%. Only about 15% of those with COVID need to be in a hospital. First and foremost, just because you had a positive COVID test, don't rush to the hospital. You don't need to get admitted because you've had a positive COVID test. That's the first thing people should understand, that, oh, my test report came positive, I need to go to hospital. No. If your mild symptoms, which I mentioned already, like my fever and cold and cough and, stomach pain and diarrhea, nausea, vomiting, you don't need to be admitted. You can get treated at home, take the necessary medicines and be all right. Only thing is you need to be on isolation. Why? You don't want to give it to others. Yeah? Because I'm seeing families coming in and people are just chilling out at home, but doing all the routine things they do. You are going to make sure everyone in your family is affected, and more so the elders. Everyone gets worried. Oh, what about my children? I have small children at home. Well, children generally do well. Okay, they don't really get affected that badly. So stop really worrying about your children. Start worrying about your elders, your mom, your dad, your aunts, your uncles, your grandfathers, your grandmothers. They are the ones who need not be exposed to this, right? You don't be around them when you. Okay, so.
Tausif, yeah.
Can you hear me? I think I was getting a call or something. I think I'm supposed to be expecting a delivery, I suppose. Okay. So if I can just go off for about a couple of minutes and come back the next time a call comes.
Yeah,
sure. Okay. Yeah. Okay. So what I was saying is that, so worry about your elders, stay in home isolation. With these mild symptoms, you don't need. About 80 to 85% of people don't need to be in the hospital. Only about 15% in whom I told you very clearly, oxygen saturation, really high fevers, persistent cough, they need to be in the hospital. And that's only 15%. But if we are a country of about 130 or 40 crores, and if you take about 15% of that, that's a huge number. And we don't have that many hospital beds in our country. For about at least a good 8 crores, we don't have hospital beds. I think my mathematics is wrong. Something like that. You understand what I mean, right? Yeah. Yeah, about 14 plus 7, 20 crores. So 20 crore beds in the hospital we don't have, right? 3%. So the best thing you can do is at least free it up for people who really need it, and not crowd it when you're mildly symptomatic or asymptomatic or panicking. Not a good idea to be in a hospital. Be at home.
Okay, I'm going to take a few questions that are coming up on the chat, and Vinod's question is, oxygen concentrators, is it useful? Is 5 liters enough for a single patient?
Yeah, oxygen concentrators are very, very useful. They're very, very, very useful because they supply oxygen at home. It's a plug and play kind of a device. You just switch it on. You don't need to go and keep refilling your oxygen cylinders and spending a lot of money. It's a one-time investment, either for rental or for thing. And does it need to be at 5 liters or more expensive 10 liters? Well, it depends on the patient. If the person is requiring anywhere above 5 liters, they shouldn't be at home, right? They should not be at home. They should be in a hospital, because you never know. It's like saying, you know what, I'm walking till the edge. I'm standing on the edge. The next is a fall. You're thinking of the edge, you're safe, while you're not. If you're a little away from the edge with your 5 liters, you're safe, because you still have some room to play with. But if you're already on the edge, the next step is a fall. And then there's really nothing you can do at that point of time. So ideally, people who are at home should be enough with 5 liters. Yes, you want to be safe and do a backup and keep a more expensive 10-liter machine. That's your call. But like I said, if they are at home, the next step for them is a fall. You really don't want to be at that level. So, but 5 liters is reasonably sensible to keep at home. I wouldn't say that that's the right thing to do, but it's sensible because you don't want to be really pushing it beyond that. And they're very useful. They're very, very useful.
Our next question is from a member of the Kidney Warrior Foundation. So when you're answering this question for somebody who's either transplanted or on dialysis, the plasma requests coming up to the community, can we get alternative treatment for the same?
First and foremost, plasma doesn't help. Okay, there is no evidence that plasma helps. So then the question is alternative therapy. When a therapy doesn't work, why do you need an alternative therapy? Okay, the alternative therapy is prevention. Okay, get a vaccine before the disease hits you. Okay, whichever vaccine is available, take the vaccine before the disease hits you. Remember, the vaccine is not for people who are already infected with corona. It is for people before they get infected with corona, and that will produce natural antibodies in your body. What is the plasma trying to do? It's trying to take antibodies from someone else's body and put it into the patient's body, right? And hoping that these antibodies will go and fight that. It's like saying, I don't have enough soldiers to fight my war, so I'm going to borrow a few soldiers from, Pakistan and going to fight the war. May or may not help, right? So then they did the study and they found that it does not help. So the soldiers from Pakistan are not going to help you fight your war. It's as simple as that, right? So plasma doesn't work. When a therapy doesn't work, don't even ask for an alternative therapy. The best that you can do is prevention by getting a vaccine before the disease hits you. That's the best thing you can do. And don't go on these plasma donation drives. Don't tell people to, come and donate plasma. I'm doing a noble thing. It is a very noble thing to donate blood or plasma. But what is the point in doing it when it's not going to help anybody? You're only going to increase costs for the patient. You're going to increase costs for who was doing it. And it's, prick in, prick out, go into an environment, do something that's not helpful. It's a waste of your time, energy, and resource.
Thank you for that answer, Tausif. Our next question is by Madhavi. How long into the disease does the person get infected?
How long into the disease does a person get infected?
Meaning when we meet another person, I think that's what she means. Madhavi, you can correct me.
How long is the person infected once they are affected with the disease is the question?
I think you can give us both the answers. How long? Okay. Madhavi, if I'm right, if I meet somebody with COVID on day number...
Yeah, infective. I think Madhavi just said infective. Okay, right. So, Madhavi, so the thing is, from the time that you are, sorry, not you, I mean, from the time that someone is exposed to the virus till about, 10 to 14 days, they are infective to other people. 10 to 14 days after they start symptoms, okay, they're infective to other people. If somebody is asymptomatic completely, for about 10 days, you should really avoid contact with other people. If they are symptomatic, it's about 3 days after the symptoms subside, or 10 days, whichever is later, is when you should think you're not infected to others. We generally tell people that at least for 14 to 21 days after you develop symptoms, please do not expose yourselves to other people or let other people get exposed to you, because that is probably the period that you're infective to anyone. Are we infective during the incubation period? It's difficult to say. It depends on how much of the viral load have you taken in. But at least once you know that the symptoms are there, once you know that the test is positive, stay away from people for 14 to 21 days. That would be the best service that you can do to anyone. That's important. Also remember, if you are on steroids, your risk of contracting an infection from someone else is also very, very high, a secondary infection. So ideally, avoid socializing till then.
Question from a member from the Kidney Warrior Foundation. What are the home precautions in terms of isolation for a kidney transplant patient who's affected?
For somebody who's had a kidney transplant, they would have done more home precautions than coronavirus when they went through the transplant, right? They are probably the best people to advise other people as to what precautions to take. They would have done the best that there is. You don't need to do anything extra than that. You just need to do that. And maybe even a little less is all right. But you just need to be in isolation, do your thing, but in your own private space. You don't need to use separate plates, and there's no evidence that it spreads through surface contact, right? It's like, I used this bag today. Unless you vigorously coughed on it, and then you give it to the other person, it not really is infective. So if you ate from that plate, and then somebody took it and washed it with soap, they're okay. It's not like they're going to get infected from that. So they're not untouchables or outcasts. It's just being smart. We're just being smart about making sure everything is clean. A kidney transplant patient, in my opinion, will know better than anybody else what kind of precautions to take. You don't need to do anything more than that. It's not that bad a disease, that quick a spreader of a disease.
Thank you for that answer. We have Manju asking us, since I'm vaccinated, I've got the vaccine in my system. So if I have symptoms and I get tested and I show positive, how do I know it's not because of the vaccine and I'm actually infected?
Okay, so let me tell you something about the vaccine. The vaccine which you have here available is Covishield and Covaxin. Now, Covishield is an adenovirus. It is not coronavirus, okay? Covishield is a vector based on adenovirus. It's like, it's like a Trojan horse. I don't know if all of you know the story of a Trojan horse. You kind of disguise something as a gift, give it to the body, and in that gift, you bring in something that will trigger an immune response. So you're not injecting a coronavirus into somebody for you to get an infection from the Covishield vaccine. Okay, so let's clear the air on Covishield, saying that, listen, boss, Covishield is not going to cause an infection for you. Okay, it only is going to trigger an antibody response and immune response because it's not a coronavirus, it's an adenovirus vector. And this information is available for you online anywhere you can read. So please take it out of your mind that Covishield can cause an infection, because it cannot, right? It's a different virus. What about Covaxin? Now, Covaxin is a killed virus, okay? So the virus is supposed to be killed, inactivated virus. And this inactivated virus is also used in vaccines like polio, okay? Do people get polio after they get polio drops? No, they make antibodies. It's an inactivated killed virus, so they make antibodies from it. It does not cause polio. At least it should not cause polio. Is there a possibility, if there is some no regulation at the lab development level or the manufacturing level? Yes, if they have not killed the virus, then they can get an infection from Covaxin, the virus. But we have very good strict quality controls that are adopted, and it shouldn't happen. Okay. Now, if somebody after the vaccine is getting infected, it's probably because of two things. One, they were exposed to the virus before they took the vaccine, number one. Or rather, they were exposed before the antibodies were developed. Okay, let me put it that way. Because once you take a vaccine shot, it takes about 3 weeks for your body to develop antibodies. It's not like today I took the vaccine, tomorrow I'm completely steel body, nobody can touch me, nothing can happen. It's not like that. Okay, it takes about 3 weeks for your body to take the virus in, absorb it, find out what it's all about, create an antibody. So for 3 weeks, you're still vulnerable. Okay, so if that within 3 weeks you're getting exposed to anybody, or before the vaccine you got exposed to anybody, you can get the infection. Number one, that's the predominant reason. Okay, you're getting exposed to the virus before the vaccine has taken effect. The second reason is social behavior. Yeah, I took the vaccine today. From tomorrow, I threw my mask somewhere. I'm not sanitizing my hands. I'm going out in roads and having a party. I'm going to a pub club. Wow, okay, you're really putting yourself at risk. I took the vaccine in January. My second was in February. Even today, I wear only scrubs and I wear mask PP where I'm out in the hospital. And I see 70 patients a day, 70 to 80 corona patients a day. I'm still protecting myself. My antibodies levels have been checked twice. They're good. I've done an RT-PCR twice after the vaccination, and I'm still negative by God's grace. Okay. So if they are getting an infection after the vaccine, it's one of these two reasons. They got exposed to it before the vaccine had time to take effect, or they are not following the appropriate social behavior. Covishield does not cause the infection because it is not a coronavirus. It is an adenovirus vector. It cannot cause infection. So take it out of your mind. Absolutely. Covaxin is inactivated coronavirus, and it is, I'm sure, having good quality control. So it should also not cause the infection. So, it's just WhatsApp misinformation that puts people at risk and makes them have risky behavior.
Yes, Manja, I hope you got your answer for that one. Pratibha I missed out a question. Pratibha asked if your oxygen levels are 94, should you still visit the hospital? I think Pratibha, Dr. Tausif has already given us an answer for that question. But if you still need, then you can tag me on the post and then we'll talk about it later because we're running short of time. We'll move on. She also mentioned about a diet. Is there a specific diet you want to follow when you're COVID positive?
I would just say follow a healthy diet, whatever you like. You have to eat healthy, because if you eat, you have the energy to fight. You don't eat, you don't have the energy to fight. I would just say avoid all the natural bad stuff like heavy on oil, high on spice, because you already have an upset tummy. You really don't want to upset it further. So don't cut down on your chilies if you're used to eating a lot of chilies. Cut down on your oil if you take a lot of oil in your diet, because it's going to trigger your gastric system, not allow your digestion to be proper, and give you trouble that way. But otherwise, we really don't restrict anyone on their diet. In fact, in our hospital, we actually tell people, if you want to get food from home and eat, it's your call. It's fine with us. We don't have a problem. Just follow these instructions. So yeah, and in our hospital, I see people eating chicken and egg and non-hospital diet stuff. So they just eat all sorts of things.
Dinesh, this is your question. How long does one need to take oxygen post-hospitalization?
It depends on how much lung damage happened. Okay, our ideal goal is to send everybody home without oxygen. That's what we try to do, keep them in hospital till a reasonable amount of time where we feel, okay, he doesn't need oxygen. But there are some people who have a lot of lung damage. And remember, you do a CT scan today, and you see some changes. For those changes to recover normally in a lung infection takes about 6 weeks. Okay, so don't get discharged from the hospital, go and take a CT scan, see that, oh, there are still patches, and get scared. It normally takes about 6 weeks or 2 months to, for those changes to recover and your lung to become normal. It's like having a scar or a bone fracture, which takes about 6 weeks to heal. It's like that. Doesn't mean your bone is still fractured. It means it's healing, but it just takes its own time. So some people have more lung damage than the others. So they require oxygen for longer periods of time till their lung can reasonably heal. Sadly, sometimes it may not ever heal. So in that case, we say you don't need to be in the hospital. You're over your disease process. You've crossed the curve. You just need to rehabilitate yourself. You can go home and be on oxygen. So we send them on home oxygen. And depending on their recovery speed, the oxygen will taper off and they will become normal. Some people with extensive damage may continue to require home oxygen for really long periods of time. So it's very subjective. It is up to the patient's lung damage and how fast is the recovery process. We just think of a reasonable time limit to when we can send them home.
Thank you for that one. We have Shiva asking us, does a CT scan help with detecting infection if RT-PCR is negative, but symptoms still exist?
Yes, it does. It does. So we look at the symptoms, we say, okay, let's do a CT scan, and we see something, yeah, the RT-PCR may still be negative. It does help, yes. What I don't want you all to do is repeat CT scans as and when you feel like. It's radiation. Okay, it's not safe. We do it only as indicated. We only do it if the oxygen level is not dropping and persistently they're needing more and more oxygen. Then we want to repeat and see what is the extent of the damage. But otherwise, one CT scan is good enough for you. Leave the doctor to decide if you need another one. Don't go and keep repeating CT scans to check, oh, am I fine now? Am I fine today? Am I fine tomorrow? Don't do that. It's radiation. It's not good for you.
So Jyoti, I've just seen your question. Instead of an RT-PCR test, can we go directly for a CT scan if we have a cough or so? I think Tausif did answer that question while he gave the previous answer. If you still need some clarity on that question,
yeah,
please let me know.
I will clarify on that. Okay. The findings that you see on a CT scan are not limited to coronavirus or COVID. Okay. I can see the same findings in swine flu also. I can see the same findings in interstitial lung disease as well. Okay. So it's not that I see this on the CT scan and this is only coronavirus. This is only COVID-19. As a doctor, I use my discretion to decide, is the CT scan matching the symptom? Are they same? And then I decide whether this probably is COVID. So it's not like you can just do a CT scan and diagnose it. The RT-PCR, on the other hand, is a very, very specific test. It is specific to the COVID-19. So we call that as the gold standard. We must diagnose using an RT-PCR to be very sure that what we're seeing on the CT is COVID-19. So we need both the tests. We need both the tests. We cannot skip an RT-PCR. We cannot skip a CT scan. We need both the tests for us to know the extent of the disease and to confirm the disease. So it's not a either or. It is both that we need.
The next question is, does proning help at home?
Oh, fantastic. Yes, of course. Definitely helps. Definitely helps. Why does it help? Okay. It's because when we are normally lying down, on our back, the alveoli, as in the lung sacs that we have, they collapse. It's like a balloon, right? So they collapse, right? So when you lie on your back, on your sides, the areas that are collapsed then open up. So you have more space for your oxygen to enter the bloodstream. So proning helps for sure. So you can prone. It's a good thing. How many different positions it calls? Yeah.
I've shared a screen. Can you see it?
I can.
Yeah. Can you help us with this image, please?
Okay, so what it's showing is lying on your belly. Now that's a very rudimentary drawing. You cannot lie down like that on your belly. Okay. What I would really tell you is put a pillow under your chest, or between your neck and chest, and then you lie down on it. Put both hands on the side, and then lie down like that. Okay. Otherwise, it becomes very difficult. You can't just lie down flat on their chest. So put a pillow under your chest and then lie down. Do it for about half an hour, because after that you start feeling the pain and the pressure. Unless you're used to sleeping on your tummy, it becomes difficult. Then change position, lie down on your side for some time, change position, lie down on your back or sit up like it's showing on the picture, and then change position, lie down on the other side, then again prone. I would suggest that if you're not really sleep, you keep changing your positions every half an hour so that you are able to make sure all the lung bases are equally recruited and you have more of your lung sacs which are allowing you to breathe and improve your oxygen levels. That's very important.
Thank you for that one. Okay. Okay, guys. Okay. Liver, pancreas, kidney, and heart problems are coming post-COVID. What are the investigations required for the regular checkups? Tausif, you can feel free to take the question or not take the question. This is by a kidney transplanted patient. If you think it's too specialized for them to talk to the nephrologist.
No, it's very vague. It's not specialized. It's very, very vague. Yeah. So we tend, like people who are asking, can people get infected after the vaccine? It's a similar kind of question. Liver, kidney problems coming up. No. COVID has certain long COVID problems. We're calling it COVID long haulers or long COVID issues that we have post-COVID when people are recovering, where they have chronic fatigue, like really tired all the time. They can be forgetful for a long time. They cannot remember things. It's difficult for them to remember things. They just feel they don't have the energy to do things. And they have this breathlessness of exertion. But they don't really develop liver and kidney problems post-COVID. They may develop it at the time of the disease, yes, but not after. They may, that means they've recovered. They shouldn't really be having any issues with their organs. If that is happening, then we need to get to your regular doctor and find out what is the reason for these things to be happening. This is after you've completely recovered from COVID and not because of some complication of COVID, you can find out what's happening there. Ideally, your doctor during treatment would have treated you and assessed all of this. If it was normal at that time, there is no reason that after you got discharged should start at that time. If it was abnormal at that time, then it's probably a sequelae of that. Okay, so usually, no, they don't have liver, kidney, pancreas problems after COVID, but they can have other problems after COVID. Only these things you can only expect if during the disease they had it, then it's probably related. If not, it's probably not related.
Dinesh's question is, in a situation where one who's non-infected has to stay in the same house with immediately recovered people, how long post the recovery is it safe?
Yeah, I thought I already mentioned about 14 to 21 days. Yeah, I think like if they were in a hospital, and they came home about a week after. If they were not in a hospital and they were at home, about 14 to 21 days after the start of symptoms.
Okay.
Now, otherwise, they can just be in a room by themselves. You just don't need to sit and socialize in the living room or the dining table or whatever.
What are the first things that you face with a patient or a caregiver who comes into the hospital and are COVID positive, may not really need hospitalizations, but mentally or emotionally really traumatized and panicking? So what is it that what are the questions that they normally ask, and what are the answers you normally give?
The first question, which you find very difficult to answer, is, am I going to be all right? I don't know. I don't know if you're going to be all right. Honestly, I don't. Okay. Because I need to wait and watch how the disease progresses. I need to wait and see what is your risk factor for the disease. What can I expect as your body's response to the disease? We generally hope anybody who's young and reasonably healthy, not overweight, no diabetes, should not be having any problem, right? But we don't take into consideration factors like the level of exposure, unhealthy living that they're having, what are the other risk factors they may be hiding, which they're not informing us, or some symptoms they may be not telling us because they are afraid to tell. We don't know all that. So the most difficult question that we find to answer is, am I going to be all right? I cannot tell you that. I have to wait and watch. I have to see you over the next few days, see how you progress. If you're getting admitted, I have to see what are the blood reports that are showing up. I have to see that and take it on a daily basis. So every day is something that I will have to figure it out and then tell you what it's going to be. At one point, yes, I can tell you from here on, you're definitely going to be all right. Don't worry about it. But till I reach that phase where you have crossed the curve, I'm not able to tell you a confident answer for that question. That's number one. Number two, I find asymptomatic patients or mild symptomatic patients coming and saying, get me admitted. I want to admit, I want to stay. Well, I can admit you as a hospital, it doesn't matter giving a bed to you or giving a bed to someone else. But if then I fill up a bed with you, and then there is another person who's going to come who needs a bed more than you, then, I'm doing a disservice to that person, right? So don't get admitted because of your panic. Don't get admitted because you're so scared that you're having COVID-19. No, only if you're symptomatic and you really need a hospital bed for oxygen purposes or other purposes, that's fine. Otherwise, try and be at home, isolate yourself. You're a healthy person, shouldn't be worrying. And watch for the right things. Know when exactly to seek medical care and be there. Don't block hospital beds. Don't block oxygen cylinders. Because other people are dying because of lack of hospital beds and lack of oxygen cylinders. Don't do all those things. It's not right. Okay. So that's the other question that I need to answer. The third question is, why should I do both RT-PCR and CT scan? Why can't I do just one? Like, okay, I need to get all the information I want so I can treat you better. So please do what is asked of you and not cross-question based on how much money you have to spend, which I think is a big, important question, but I'm helpless. I have to do these tests for you. And, or, based on what you might have read on the internet or what was said, that's important. Don't go and ask the question to your medical or allopathy doctor, oh, does this homeopathy medicine work? Oh, does this olive oil work? Does these other home remedies, do they work? There's this new drug, aspidosperma. Does it? I don't know. I don't know if it works. I was not trained to handle all of those things. Okay, they didn't teach me if olive oil really helps in coronavirus. I actually don't think it does. I don't think olive oil helps, but it's my personal opinion. I don't know, but scientifically, if it helps or not, I just don't see the logic behind olive oil helping in coronavirus. Okay, it's just an expensive oil you need to buy. I don't know why you want to buy it. So non-medical questions, don't ask your doctor. He's going to be flabbergasted. He will not know what to answer. He might just give you some answer which is pleasing to your ears, but honestly, we don't know about all those things. These are some of the common questions that I come across. Yeah, but the most difficult question that we have to face is, am I going to be all right? I honestly speaking, I don't know. I'll have to wait and see how you do. And then, of course, people who are brought dead to us, they ask us why. I don't know either. Okay, I don't know what was the reason for the delay and why they just suddenly dropped dead at that point of time. I don't know that either. I can only help you through your grief, but not give you an answer to that question.
How vulnerable are kids below the age group of 12 in the current
At this point, they're not vulnerable. They are probably the healthiest amongst all of us. They're very healthy. Okay, they just breeze through the illness. Till last year, pregnant ladies were also the same. This year, we are finding pregnant ladies with some symptoms. Okay, but at this point, children are still safe. Yeah, very, very, very rare instances of children suffering from what we call as MIS, multi-system inflammatory syndrome. But very, very, very rare, very rare. Children are very safe from COVID. And that's why I keep telling people, don't worry about your children, worry about your elders in the house. Okay. our natural tendency is to protect our children. Our children, by God's grace, are still safe. Yeah.
For a woman who's COVID positive and is on her menstrual cycles and having extreme blood loss, and obviously is going through tiredness, how would she differentiate when she has to go to the hospital and seek help?
When she's feeling extremely tired.
Okay.
That's a simple answer. Because remember, this is a disease of oxygen, and you need blood to carry oxygen. If you don't have blood in the system, you're not going to be able to carry oxygen. It's that much worse for you. Okay. So there should be blood. Yes. So if we actually, interestingly, have had 2 patients like that, and we've had to transfuse them, and they've recovered very well. They've done very well for themselves, right? So you need a blood transfusion if you're bleeding too much in your cycles and you have COVID, because already your oxygen carrying capacity is affected, and then there's no blood to carry the oxygen. You're going to have worse symptoms, more difficulty in breathing, more tiredness. So if you're feeling that, go to the hospital and get yourself admitted. Like swelling in your feet, no blood, more difficulty in breathing, very, very tired. You probably need a transfusion, a blood transfusion, which will help you recover from the disease.
All right. Okay, I think we have overshot our time already by
about 45 minutes.
So sorry for that.
Yeah.
But I'm going to end with just one simple question that I think you're the best one to tell us. If we've known a person who is COVID positive, a loved one, what is the first thing that we tell them that will make them feel better at that given point of time? Yeah, one thing is not everybody who has COVID needs to go to the hospital. That gives some hope that I'm not going to be the one dying of COVID. But if there's something that we have to tell, because most of the time we are stuck, we don't know what to say.
Right. So the best thing that you can do is arm yourself with enough knowledge to then calm them. Because somebody who's just been diagnosed with COVID are scared, whether they like to admit it or not, they're scared, right? So the best thing that you can do is get them to discuss with you what they feel like doing from there on. And if you are reasonably knowledgeable about it, it reassures them so much, right? And that's what we do as doctors. I go to work, I come back, I'm really tired, but from about 6:30 in the evening till about 11, sometimes 12-ish, I'm constantly getting calls and messages from people who've just recently been diagnosed and what do they want to do. And all I'm trying to do is reassure them. Of course, as a doctor, I can also send some medicines, but I'm mostly reassuring them and telling them, okay, these are the things you can expect, and these are the things that we can do. What are you going to, don't worry about it. 85% of people recover from COVID. There's no need to panic. We need to watch out for a few things, and we can do that, right? Of course, this is on as needed basis. You're not going to go and dump information on somebody who may or may not want it. It's not unsolicited advice, but at least reassuring them that, listen, we can get through this. Don't worry about it. A lot of people are doing well, might do wonders for their state of mind. The one thing that you want to do for them is to prime them for facing it bravely. That's what you want to do. You want to make them face it bravely. And when they are brave about it, it's easy to do it. Once they start getting scared, they make a lot of wrong decisions, and it's not a nice thing. Yeah. So tell them to be brave. And to that, you probably need to know a little more about COVID.
Yeah. Thank you so much, Tausif, for joining us. And it's so kind of you. And a lot of them are really appreciating this session. And on behalf of everybody who's joined us, thank you once again.